Public health doctors in the United Kingdom launched on Tuesday what is considered as the most disruptive strike in its history in a dispute over pay and working conditions. The four-day walkout, which began at 7 a.m. local time, follows months of strikes by other public and private sector staff as inflation sparked the UK's worst cost of living crisis in a generation. Protesters demand a pay rise of 35%, which they say is needed to help make up for more than a decade of salary cuts in real terms. The government says the good doctor's request is unaffordable as ministers try to dampen wage demands across the public sector amid stagnant growth and high inflation.
Doctors are striking today because we've seen our pay cut by more than 26% over the last 15 years. It's a signal of being undervalued, and ultimately that's driving doctors away to places like Australia, New Zealand and Canada, and that has rippling effects through our workforce and ultimately for patients. So we're striking today to have our voice heard, to restore that pay, to reverse the pay cuts that have been imposed on us by the government.
The demands are much more than valid. In fact, it's surprising that there haven't been demands like this for years. And in fact, the staff are hemorrhaging from the NHS. They have already gone. It means that the current workers, nurses and doctors, are actually very overworked because there aren't enough of them. That's not made enough of. They are exhausted, and this is just not good enough.